Morning, my name is JB Georges, and today I'll be discussing thoracic outlet syndrome, symptoms, and treatment options. Thoracic outlet syndrome, also known as TOS, is the compression of the nerves and the blood vessels within your neck, and it's located between the human clavicle and the first rib. And if you can tell from the graphic, it does cause pain, numbness, and weakness in the neck, the shoulder, chest, arm, and body, and the hands and fingers, and they can happen on one side or both. There are a wide range of symptoms that vary from person to person, depending on the nature and the severity of the symptoms, which may be indicative. Now, according to the NIH, more than 20 million people suffer or pain and inflammation, or even nerve damage, which is also known as neuropathy, and more than 165,000 cases of neuropathy from thoracic outlet syndrome are diagnosed every year. And the pain levels I mentioned before can vary in terms of intensity, and it also varies from person to person and depends on the kind of damage that they might be suffering, whether it be from trauma, sometimes anatomic abnormalities, sometimes people are born with it, or maybe just irritation from repetitive motions. If you think about it, a lot of athletes actually have suffered from thoracic outlet syndrome for years of training and moving their bodies, but it's not just about competitive sports or being an athlete. Sometimes non-athletes have it. Sometimes it can just be from household chores, repetitive motions over using your arms over your head or repeatedly, sometimes bad posture from sitting or standing. And as I mentioned before, it can happen on one side of the body or both, and symptoms do vary from person to person. As I mentioned, the thoracic outlet syndrome is located in the neck primarily, where it's an interaction of different nerves and blood vessels in the brachial plexus. So you have your nerves that come from your cervical spine, in the back of your neck, and it wraps around and it goes through your neck and it meets with your arteries and veins, and then it goes down from the neck from your shoulders, your armpits, all the way down to your hands and fingers. And there are three different types of TOS. The arterial, which is the pressure on your arteries, happens in about 1% of the reported cases, and it's also a common cause of acute blood clots in the arms and hands, and also varies depending on one's anatomy. And about 70% of the women who have TOS from the artery also have reported cervical ribs, which is an extra bone which can be formed in your chest, causing some pain and pressure on your nerves and blood vessels. Also, the venous TOS reported in 4% of the cases, which affects 1 to 125,000 people, and is common among men in their 20s and 30s, especially those who are very physically active. And it is reportedly happening mostly in the arms. And there's the third, which is the neurogenic, which is the most common, happening in about 90-95% of the reported cases. It affects 1 in 40,000 people. And it's most common among athletes and even non-athletes who overexhaust their upper bodies and necks in different kinds of motions and exercises. Now, the symptoms I mentioned before are wide-ranging, and they vary. They can be caused from nerve damage or poor circulation, and it can cause a lot of pain and tingling, numbness, and weakness in the neck, shoulders, chest, arms, and hands. It might also result from the lack of circulation, cold skin on your fingers, and also occur randomly depending on whatever triggers come from your body movements. Now, the key thing is to remember is to always listen to your body when you realize that something is wrong. You should never dismiss your symptoms. You should seek medical attention if you suspect that you might have TOS. So you should share those symptoms and your medical history with your primary care physician or with specialists who work in these areas. So always try to track your routines and identify what might be triggering your TOS symptoms, and share that with your doctors and health specialists. Now, there are different ways for them to try to diagnose it. They can try to use x-rays, CT scans, MRI scans, sonograms, and also possibly even do spinal and neck injections to determine if you might have TOS. But it's always good to get a second opinion. Never just go by what one doctor may say. You might need to go see another specialist to find out if they concur, or even to get multiple opinions to make sure that you have a better grasp and knowledge and understanding if you have TOS or not. Now, consider non-invasive measures first. Sometimes people think, oh, let's go do surgery and take care of this right away, but it not necessarily be the right option. I'll discuss that a little bit later. But try to consistently follow whatever the prescribed physical therapy regimens or prescribed medications that doctors might provide. But medication does not mean that it's permanent relief. Sometimes it's just temporary. And try to think about pursuing a healthier diet and regimen lifestyle to make sure that you eat foods that help with and address your nerve inflammation. Now, consider non-invasive measures also means that you need to also probably think about constructing a healthier mindset, making sure that you're trying to be more active in ways that are going to be painless and mild in terms of your exercise regimen, eating healthier, getting plenty of rest, and also finding support from family, friends, and other people who are dealing with TOS, either in person or virtually, because there are a variety of communities that are out there on Facebook, on a variety of other platforms, websites, and also just meeting people in your area. And as I mentioned before, lifestyle changes will help a little bit, in some cases even help some people with eliminating all of their symptoms. However, also keep in mind that surgery should be the last alternative, especially after all the other conservative treatments haven't been successful. And surgery can happen either on one side or both. It might require the removal of the first rib or moving some muscles around the brachial plexus, but most likely the first rib is what they have to remove so they can free up and open up your nerves and your blood vessels. And in some cases it might even require spinal surgery if necessary to get access to the nerves there and to free them up and open them up. And usually recovery is for post-op rehabilitation is very extensive and may require further surgery in terms of complications because surgery may not necessarily relieve or cure everything. Hematoma, which is flooding and clotting of the chest cavity, might cause a buildup of fluid in the air, so you might have lung collapse, and video-assisted operation to help relieve and open that up. And also the procedure might require removal of some muscle tissue from your neck, chest, and shoulders, and also possibly lead to death. But the possible outcomes that are really important in terms of understanding what happens if you don't treat yourself is the possibility you might have permanent arm swelling and pain, permanent nerve damage, and possibly clots that might travel to your lungs, known as pulmonary embolism. And the key thing to recall is that if you don't take care of it, that these blood clots, other issues such as gangrene, and reducing the blood flow leading to open sores can also be a major issue for you down the road. And you always have to make sure that if you do have these symptoms, doesn't mean that you have TOS. You should speak with the doctor to make sure that you have the condition and that there are different options for you to pursue it to relieve yourself. And if you are diagnosed with it, always keep in mind what the triggers are of your symptoms, so that way you can try to avoid it. And surgery doesn't have to be the ultimate option. There are a variety of options for you to utilize or to approaches for you to consider to improve your well-being. So again, TOS doesn't have to ruin or be destructive to your life. Just discuss what you've learned here today, share with your family and friends, and discuss it with your healthcare providers if there are different options or alternatives. And also do your own research. That doesn't mean that this presentation is the end-all. There are a variety of websites, hospitals, health organizations, medical journals, and articles as well that you can follow up with, because having knowledge comes with having power over your own well-being. And here are some of the sources that I've referred to in this presentation. And I just want to let you know that someone who has actually dealt with thoracic outlet syndrome and still continues to deal with it, I'm continuing to try to thrive and make the most of my life, and I'm sure that you can and will as well. So take care, and thank you for listening.